Hello, I'm Dr. Yael Halaas, board-certified facial plastic surgeon in New York City, and I want to welcome you to the American Jewish Medical Association. It's surprising to hear that we never had this organization before. Indeed, it was only in the aftermath of October 7th when so many of us looked around, and instead of seeing the compassion that we would expect from our fellow physicians and healthcare workers, we actually got silence or negative comments. And it's unfathomable to many of us that this situation could exist, that there could be hate within the halls of medicine. But realizing this, I started a WhatsApp group, which began as several hundreds of my colleagues coming together as U.S. doctors fighting anti-Semitism. And quickly, within a month, when I realized that we had no voice for us American Jewish healthcare physicians, nurses, PAs, OT, PT, social work, veterinarians, dentists, we really had no voice representing us. We all moved quickly to form together the American Jewish Medical Association. And there are so many of these groups. There's a Catholic Medical Association, Palestinian American Medical Association, really for so many groups, but none expressing the Jewish voice. And the Jewish voice has been present. You can go back to Maimonides, as so many of our institutions are named after. But we never had a unified voice in this country. And so today we do. We are a fully incorporated, full 501c3 charity with a full board and bylaws so that we can represent our voices. And our voices need to advocate right now in this hateful period during this incredible rise of anti-Semitism, but also to bond together, grow together, and to celebrate how much we have contributed to medicine in America and around the world. So thank you for being part of the American Jewish Medical Association. I invite you to check out the members section, which has so many resources available to you. You can join per specialty. You can join per state. We have chapters in many of the U.S. states across the country. There are many chapters that are specific to different hospitals because there are so many hospitals within many of our metropolitan areas. And there are also committees dedicated to certain really important initiatives that we are working on. What are some of those committees? One that I'm incredibly proud of is our Journal Publications Committee. That committee specifically is looking at everything that is going on in this world right now, and publishing scholarly articles that are balanced, that provide both sides of the equation in the Israel-Palestine conflict, that show and highlight what Israeli medicine really is and all that they can contribute to the world. As we've been seeing, a lot of the publications are publishing a lot of false narratives. So this incredibly strong committee is publishing in The Lancet, BMJ, all the major American journals to make sure that we have a balanced viewpoint getting out there. And we're also strongly united with Israel and our colleagues around the world. Through, again, the newly formed Global Jewish Healthcare Alliance, we are allied with the Israeli Medical Association and their Justice Health Initiative, which is also publishing scholarly articles together with us. Australia, New Zealand, South Africa, Belgium, Italy, Netherlands, UK, all around the world, so that we can provide a united voice, because the Jewish people are truly a minority. What are some of our other committees? We have a response arm and a reported cases committee. So unfortunately, so many cases are flooding in from both doctors who are experiencing this in the workplace, but also from patients as well. And then we have a response arm which targets a correct action to deal with the anti-Semitism that is specific to the healthcare world. Another very important initiative is our curriculum committee. There's a lot of resources out there to teach about combating anti-Semitism. But a curriculum specific to medicine has never been done before. Our curriculum committee has created that curriculum, and in working with some of our partners like the Arnold Gold Foundation are making sure that it gets sent and understood and practiced by medical schools and nursing schools throughout the U.S. Another initiative has been reaching out to all of our deans of our medical schools and making sure that their curriculum and the heads of hospital centers to make sure that their policies are not allowing for anti-Semitism to creep into their curriculum and into their policies. So there are so many ways that you can participate. Another wonderful resource is all of the scholarly articles that we have that you can find also in our members section, as well as our celebration of Jewish American Heritage Month, which is usually in May every year. And we have an incredible resource that can be used by your hospital, by your employee resource group, to celebrate the contribution of Jewish Americans in healthcare. So thank you for listening, and I welcome you to the AJMA, and I look forward to hearing from all of you.